Chronic lower back pain currently impacts some 28% of Americans. When I set out to cover this topic, I expected compelling evidence of such conditions being relieved through mind-body medicine. What I didn't expect was a shift in my own chronic pain condition. Up to just a few weeks ago, I was forced to stand, kneel, sometimes sit perched on the edge of my seat to alleviate discomfort. But somewhere in the course of working on this story, my discomfort is gone. I haven't undergone any special therapy, but I am thinking about the pain differently, based on what I've been learning. And as my esteemed guest today, Dr. Howard Schubiner, says, the education can be curative. You may like to see part 1 of this 2-part with Dr. Schubiner first. The link to that is at the top of the comments and in the description below. Dr. Schubiner is a world expert in treating chronic pain and in mind-body medicine. He's also a clinical professor at the Michigan State University College of Human Medicine. Today he reveals how pain caused by danger signaling in the brain is unlocked, and he outlines exercises that can lower this danger signaling. We'll also hear how using the mind-body method, an NBA superstar curbed the back pain that had him sit out more than 100 games over 5 seasons. Welcome to Vital Signs, where we learn how to get healthy from all angles, from the biochemical and nutritional to the things we do that nourish our minds and our souls. I'm Brandon Fallon. From our earlier conversations talking about the mind-body medicine approach to pain, I've gotten the impression that this has a real optimistic, positive premise to it in the kind of thinking that it engenders. So I wonder, for someone who's had maybe certain extreme circumstances like heavy trauma that set them with a particularly negative bent, is this still for that kind of person, or is it more for someone with a generally more positive outlook on life?
Well, the therapy is for people who are suffering. There's about 1.5 billion people worldwide with chronic pain. In the United States, that number is somewhere between 50 and 100 million people with chronic pain. All sorts of pain. Back pain is most common, but lots of the other ones, as I've mentioned. And there's just so much suffering in the world. People are, and modern medical treatments often are ineffective for helping people with these chronic pain conditions. And alternative medicine treatments aren't necessarily effective either. And therefore, people are just really desperate. We've seen people with 5 years, 10 years, 20 years, 30 years of chronic pain completely have reversals by using this model. And so clearly, people that we see are those, one, they're suffering, but also those who are desperate for cure and willing to do almost anything to get better. Because the model that we're using, as I said before, it's not the first model people think of. It's the last model, because the first model they think of is all the medical intervention, medications, injections, surgery, and all that sort of thing, or alternative medicine approaches as well. And when it comes to the mind and the body, that's not commonly really understood or known by the general public. But the people we see will do anything to get better, and they'll try this and they'll look at it. And the models that we have just really make common sense once you open your mind to learn about them, to think about them, to see how they apply to your own situation. And when you see that, then people start to gain optimism, like, geez, maybe there is hope. Maybe there is hope for reversal. Maybe I can get better. And that is a process that feeds on itself in a positive spiral.
That makes sense. It starts with that glimmer of hope, I guess, and that opens the door for more optimism to shine in. We'll hear about NBA star Michael Porter Jr.'s back pain recovery from Dr. Schubiner in just a moment. First, though, if you've had your own experience in managing chronic pain, if you found a working solution, we'd love to hear about it. If you're watching on TV, you can find Vital Signs at epochtv.com to leave a comment. And you can subscribe for full access to our ever-expanding insight on fine-tuning your health. Just hit the big red button below. Michael Porter Jr., or MPJ's, scoring talent helped secure his team the Denver Nuggets championship win over Miami in 2023. Seeing Porter Jr. perform on the court, you'd never guess that he was struggling with a chronic pain condition. But as he told USA Today, he was all but immobilized by back pain after that championship victory in 2023. By this point, MPJ's back had been operated on 3 times, and he had missed more than 100 games in his first 5 NBA seasons. Desperate for a solution, he came upon the work of mind-body medicine pioneer, the late Dr. John Sarno, once a physician and professor of rehabilitation medicine at NYU. After reading books of Sarno's like Healing Back Pain, MPJ found a therapist trained in his method. His first homework, he told The Guardian, was to journal for 20 minutes a day, uninterrupted. And in doing so, the link between his back pain and the pressure to perform on the court was revealed. I asked Dr. Schubiner to give his insights on MPJ's recovery.
And so Michael Porter Jr., his back pain was due to a neuroplastic condition. In other words, the pain was real, but it was generated by the danger signal in the brain. And so then the next step is, well, gee, what's causing this danger signal in the brain to be generated? Is it that you twisted and turned and you became so fearful of moving that you did less and less and less, and your brain just learned that pain as a learned neural circuit and it just continued kind of as a bad habit? Or was it also due to stuff going on in people's lives? And in Michael Porter Jr.'s case, he had a brother who had a lot of difficulties, so a lot of family issues that was really weighing on his mind, and that was part and parcel of the cause. So we have a variety of treatments for these neuroplastic pain conditions, and it's not only back pain. Of course, it can be tension headaches, migraine headaches, irritable bowel syndrome, fibromyalgia, chronic pelvic pain, a whole variety of things. It can also be chronic fatigue, insomnia, anxiety disorders. So all these things, when they're actually caused by the brain, we can reverse them or eliminate them by lowering the danger signal in the brain. And that may be due to, and we can do that through 2 main processes. One is reversing the neural circuits in the brain by calming and soothing the danger signal. And another is the emotional types of work that you're alerting to with the expressive writing. And there's a variety of ways to do that as well.
In former Fox journalist John Stossel's case, feelings of rage were at the heart of his chronic back pain. Stossel is one of a string of celebrities, including Larry David, Jimmy Kimmel, and Howard Stern, outspoken about their back pain relief via a mind-body approach. In 1999, Stossel reported on his experience in a 2020 report. Here we see him being counseled by Dr. John Sarno.
So I'm in such a rage about something that I'm making myself suffer.
But don't you see, your brain actually thinks it's doing you a favor by doing this.
By distracting me from what I really don't want to think about.
Exactly.
Stossel had suffered back pain for 15 years before learning of the work that Dr. Sarno was doing. He said that after seeing Sarno and reading one of his books, his back pain got immediately better. For a while. 6 months later, the pain came back. Realizing that he hadn't followed Sarno's suggestions, which included going to one of his seminars, Stossel finally went, and the pain got better again. Back around 2011, he said that he'd been virtually pain-free for 10 years. The idea that repressed emotion like rage can cause back pain reminded me of how psychological trauma can play out as very real physical symptoms, as seen especially in PTSD, where it can manifest as things like stomach upsets, skin rashes, and chest pain. And just as mind-body medicine for pain appears to work at the juncture of memory, emotion, and the central nervous system, one of the most effective treatments for PTSD, eye movement desensitization and reprocessing therapy, or EMDR, also deals with memory, emotion, and can lower the stress response of the central nervous system. With EMDR, the patient's focus is brought to their trauma memory at the same time they're given bilateral stimulation. This is often in the form of back and forth eye movements directed by the therapist. Exactly how EMDR is able to bring about such a change is still something of a mystery, so I was interested to hear Dr. Schubiner's take on how it might work.
Childhood trauma causes the brain to be set in a more sensitized fashion, a more high alert fashion as people go through life. If someone has been severely hurt or criticized or betrayed or abandoned in their childhood, and then later in life they get criticized or abandoned, then their brain is much more likely to turn on some kind of danger signal. I was treating a military veteran a while ago, and he thought that his PTSD came from being in the military because of the things that he saw there and did there, which was true. But it was also because of the childhood issues that he had in his life growing up, which sensitized his brain and made him more likely to develop PTSD later in life. And so the treatment models that EMDR is, and the treatment model Mark Lumley and I have developed called emotional awareness and expression therapy, and the expressive writing that you talked about earlier. And there's a whole bunch of other psychological treatments for PTSD. All of them work to rewire the brain, reprogram the brain to not only view, but also experience the events of their past in a less traumatic way, in a way which is more kind to themselves, loving to themselves, in a way that helps to empower themselves to be less affected by the events that happen, that you can't change the events. But what's interesting about PTSD is that it's based on memory, because how do we know what happened in our past? It's our memory. Memory changes all the time, and so our emotional awareness and expression therapy is based on memory reconsolidation and these other treatments you talked about as well. So the point is that the brain is neuroplastic. It's always changing, and it can change in a positive direction as we do these kinds of therapies. And the pain is a message that there's something wrong. And so the message then needs action. And that's what we're about. And if you don't need medical action, if it's not a structural problem in the body, then that's our message, that the pain and other symptoms certainly may be reversible, as opposed to just having to cope with them on and on. And if you look at the field of pain management, modern medicine pain management, most of it is based on chronic pain needs to be coped with and lived with and not cured. And we believe that we have better methods, and we've shown that through our randomized controlled research studies.
With the example of the veteran suffering trauma that went back to his childhood, I'm interested to know specifically how a mind-body approach was used in that kind of situation to reduce his PTSD.
Yeah. So one of our colleagues at UCLA, Los Angeles, works at the VA hospital there. His name is Brandon Yarns. He's a psychiatrist, and he's done several randomized controlled trials using emotional awareness and expression therapy with veterans. The veterans he treats are older. Their average age is in the early 70s. They get pain for an average of 20 to 25 years, high levels of PTSD, anxiety, and depression. And in these randomized controlled trials using the emotional awareness and expression therapy, compared to the standard psychological treatment of cognitive behavioral therapy, he's finding much better outcomes with EAET. So an example of that would be this veteran that one of the veterans that I treated came out of the military with anxiety, depression, PTSD, pain all over his body, could not find help through medication therapy or injection therapies through the hospital system, because it's the standard treatment that's not looking at the relationship between the brain and the body. And one of the things we did with EAET was to take him in his mind to go back to situations that were in his childhood and also situations that were from the military, so that he could go back and actually change some of those memories. In other words, imagine himself going back in time to help his younger self when he was 8 years old and his parents were getting divorced, and help him to give love, and it sounds weird, but to give love and caring to his younger self, to help his younger self stand up and speak and yell at his parents and scream at him and say, "What are you doing? Why are you doing that?" And do a similar type of thing in the military. In the military, he had people who were really coming down hard on him. And to be able to express feelings about that. And that process freed up this danger signal in his brain and made his pain immediately, after that, his pain immediately went down. And then he continued to calm and soothe his brain, telling himself he was okay, he wasn't damaging his body, do more of these emotional exercises, write about them. he was housebound literally. Now he's back at work, or he's going to school, he's studying, he's got his life back. And it's just an incredible process to see.
Very encouraging example to hear, Dr. Schubiner. Thank you for illuminating that in a very specific way. Another thing I wanted to ask you about is mindfulness. I know that this fits into the system of things that are used to help alleviate chronic pain.
Sure.
My understanding of mindfulness is it can involve focusing on something like a sound or a bodily sensation to train the mind's concentration. How does this practice fit into mind-body method for alleviating pain?
Yes, right. We use mindfulness meditation, mindfulness type techniques in our treatment approaches. One of our treatment approaches is called pain reprocessing therapy, and it uses a form of mindfulness. But it's a specific form of mindfulness which sends feedback to the brain to tell the brain that the symptoms are not dangerous, to appraise and look at the sensations, even if it's pain, which is horrible to be in pain, or nausea or fatigue or anxiety, to look at those sensations with less fear, to observe them, to step back from them. And that's part of mindfulness techniques. What's important about our work is we're combining these mindfulness techniques with the assessment techniques that I talked about earlier, how we can know for sure that certain situations, certain conditions in the body are not structural. So if you're applying mindfulness to a condition you think is actually structural, it would only have a limited benefit. But if you're applying mindfulness to a technique, to a situation where you are assured that it's not damaged in the body, like Larry David was, right? You're stepping back, you're observing the sensations, you're calming and soothing that danger signal in the brain. That can have very powerful effects on reducing or actually eliminating pain in these other chronic conditions by this combination of knowing that it's not structural and applying this calming, soothing message to one's own brain.
That makes sense, having that foundation of knowing that the pain doesn't have a structural cause. I can see that lightening a person up to be able to expand their awareness and experience that pain with less fear. Knowing that this mindfulness involves focusing on bodily sensation, can you give a more specific example with Dr. Schubiner of exactly how this might play out in the therapy?
Sure. Well, you can focus on the sensation. If you're feeling anxious, you can focus on the sensation of anxiety in your chest, feeling it, noticing it, watching it, observing it, seeing what happens when you tell yourself, I'm okay, I'm safe, I'm not in danger. Maybe it goes down, and then you start to worry about something, and then it goes up, and you can see it going up and down. With painful sensations, sometimes what will happen is the pain sensation will shift a little bit. It'll be over here, and it'll be in the middle part of the back, and then it'll move to the lower part of the back. And then you're going like, whoa, what's happening, right? Because a structural damage situation doesn't shift around, doesn't move like that. Where you see that it'll be triggered by the wind, or triggered by certain thoughts, or triggered by heat or cold or the weather. And all of a sudden you begin to realize, wow, actually it does change, it does shift. It actually is my brain moving it around, making it go up and down. And when you see that as part of mindful awareness, that gives you more understanding of what it is. Less fear of the sensations. And the less you fear them, the more you can observe them, the more you can maybe even smile at them sometimes and say, oh, I see, it's okay. Realizing that your brain isn't trying to harm you, isn't trying to betray you. It's actually trying to protect you or alarm you or alert you, kind of like a smoke alarm does if there's some kind of injury in the body, or in the case of neuroplastic pain, if there's some kind of stressful situations in life that your brain is reacting to.
I think this really bespeaks a kind of revolution in the way that we relate to ourselves and our brains, because I think we're often in a kind of conflictual relationship with our brains. And these kinds of approaches, mind-body, like the eye movement desensitization and reprocessing that I was talking about before, are really intriguing because they seem to kind of bridge that communication gap and open up a channel of mediation, perhaps, between the physical sensation and what someone's emotional state might be.
Yeah, right. I think we all know that we have relationships with other people. But I've been fascinated to learn is that we all have a relationship with ourselves, how we treat ourselves, how we think of ourselves, how we see ourselves. And when people see themselves as being, inherently bad or inherently a loser or inherently not smart or not good enough or not pretty enough or whatever, then those kind of messages that we're giving to ourselves can be detrimental and can cause the brain to feel afraid and fearful and can cause symptoms like anxiety, depression, fatigue, and pain. And so when we change that relationship with ourselves to begin to see ourselves as actually being okay, being smart enough, being good looking enough, being caring enough, being enough, that can make a huge difference in how our brain treats us, because how we treat it feeds back on how it treats us. And that is part of this revolutionary understanding of how these mind-body conditions work and how they can be reversed or dramatically reduced.
What about other conditions like muscle pain and joint pain? Can they be treated through mind-body medicine? We'll hear about that shortly. First, though, on the earlier topic of eye movement, desensitization, and reprocessing therapy for relieving trauma and unresolved stress, here's a snapshot of my interview with EMDR practitioner Marilyn Luber.
He was getting a political prisoner out of some country, and he was with his unit. Some loud noise went off, and he was blown through the ground, and so he had a memory of being blown through the ground with only his foot out, which is actually what happened to him. And after the first time we did EMDR on that, he stopped having a nightmare he had been having for 30 years.
Eye movement desensitization and reprocessing, or EMDR, is a psychotherapy used for treating trauma and other adverse life events.
The memory was getting reprocessed and changed and really transformed. You get a chance to help clear out all of the old material, focus on the present triggers, and then generalize things by going into the future.
Afterward, find the link to that video at the top of the comments and also in this video's description below. And to get notice of new Vital Signs videos, follow me at Vital Signs Brendan on Instagram and at C Vital Signs on X. Another question that I have relates to some of these conditions that you've mentioned, including chronic migraine, chronic fatigue, irritable bowel syndrome, that can potentially be relieved through a mind-body approach. I know that some of these have also been identified in some places as having an autoimmune origin. What does this suggest about the connection between what's going on in the mind and what's happening with the immune system?
Yeah. Well, certainly the major disorders that we see are not actually autoimmune disorders like fibromyalgia, irritable bowel syndrome, migraine headaches, tension headaches, chronic back pain, chronic pelvic pain. Those are not autoimmune conditions per se. The autoimmune conditions of rheumatoid arthritis, lupus, psoriasis, scleroderma, ankylosing spondylitis. There's a variety of autoimmune conditions that can certainly cause muscle pain and joint pain. And one of the questions that comes up is, can the mind-body approach also help these autoimmune disorders? And we think it can to some degree, certainly, because the brain can actually affect the immune system. And so we will, with the autoimmune disorders, we will typically use a combination of medical treatment plus mind-body type treatments. But it is back to the other ones, fibromyalgia, irritable, etc. We don't consider those to be autoimmune conditions. And the reason is that when you use powerful anti-inflammatories, like steroids for those conditions, that doesn't work. When you use steroids, powerful anti-inflammatories for the autoimmune conditions like lupus, rheumatoid arthritis, it does work, has dramatic effects. So we think of those as in different categories.
That's very interesting. Just lastly, Dr. Schubiner, you mentioned some signs like we were talking about mindfulness, like a person might notice that their pain is moving to different parts of the body as a cue that this isn't a structural problem. For viewers who are watching this, who are maybe dealing with chronic pain and wondering, is this something that is based in my brain that using these kinds of therapies could bring relief to? How might they begin to start checking for themselves whether that is the case and it's not a structural problem?
Yeah, I would suggest free websites. One is our nonprofit called the Association for the Treatment of Neuroplastic Symptoms, symptomatic.me, the TMS Wiki, tmswiki.org. And there's a course that I put up on Coursera, coursera.org, called Reign of Pain. And these are all free sites that people can go to that have a ton of information about how to determine if their condition is neuroplastic or not, what are some of the treatments, and resources of books that are on this topic, research articles, bibliography on the topic, and all sorts of questionnaires and information that people can use. And these are all free.
I've heard there's also something available in terms of an app, perhaps related to the PRT or EAET therapies. Could you speak a little bit about that, Dr. Schubiner?
There's a number of apps and kind of commercial companies that are working in this space. One is called Curable, that I'm associated with. One's called freedomfromchronicpain.com that I'm also associated with. Lynn.health that I'm not associated with, but I help them. Amenda. There's a couple other in development. There's some in Europe. So there's a lot of activity in the space. And once you get online and start searching, you will find all of these. And all the books, there's so many books now that have been written by Dr. Sarno's books I've written, books by Alan Gordon, book by Cossacks, David Clark, David Hanscom, Georgie Oldfield, David Schechter. There's just so many people who've written really great books on this. And again, books are, we're talking about $10, $20 to get this wealth of information.
Dr. Schubiner, thank you so much for joining us on Vital Signs and offering this very hopeful message for people dealing with chronic pain and related conditions, and really illustrating how this works with some very compelling examples. Thank you.
Thank you so much. Thanks for having me. Appreciate it.
We've heard the striking evidence that the brain is neuroplastic, that it's always changing and can change in a positive direction. Mindfulness meditation can lower danger signaling in the brain. Expressive writing can bring emotional triggers of pain into awareness. Links to Dr. Schubiner's website and book, Unlearn Your Pain, are in the description. Here's a look at Ease Back Pain Part 1, explaining comedian Larry David's overnight recovery from chronic pain. Dr. Schubiner also breaks down how pain reprocessing therapy works to resolve pain's root cause.
The brain can create pain that is real in the presence of physical injury, obviously, to protect us. It can also create pain in the absence of physical injury when there's something going on in our lives that might be particularly stressful or emotional. They will develop chronic headache pain, back pain, stomach pain, or other disorders. But if you don't know that neuroscience and you haven't explored it, for the average person, it makes no sense. You're telling me I've got this severe pain in my back, and you're telling me it's coming from my brain? The pain reprocessing steps are to begin to notice the sensations that one has with less fear and less worry about them. Because the more fear of the pain, the more the danger signal creates more pain.
I'm aware of a veteran study that was recently done with looking at Qigong that showed positive results for relieving pain. Would this kind of slow movement off Qigong and the focused mindfulness, do you think would that have played a role in these results? Just click or copy the link in the top comment below or in the description to see that video. Also there, the link to my talk with veteran eye movement desensitization and reprocessing practitioner, Marilyn Luber. She's effectively used this method to help veterans overcome the trauma of war. It's been great to be with you. I'm Brendan Fallon, and this is Vital Signs.